Hello, and thank you for joining my presentation. My name is Lorena Rojo, and today I will be presenting my research on comparing the Picture Exchange Communication System, or PECS as we typically know it, in sign language and increasing mundane behavior in a child with autism. And the goal for this study was to explore which intervention, PECS or sign language, was more effective in increasing mundane behavior in a 5-year-old girl with autism. Because mundane is very essential communication skill for all of us to request for what we need or for what we want, which can significantly reduce frustration and improve social interactions. PECS and sign language are both widely used interventions for teaching communication, but there hasn't been a direct comparison between the two in terms of their effectiveness for increasing mundane behavior. And this gap in research motivated my study as it could inform best practices for teaching communication to children with limited verbal skills. The participant was a 5-year-old girl diagnosed with autism, and this girl had prior experience, very little experience using sign language, but little to no exposure to PECS. We used an alternating treatment designs, which allowed us to compare the effectiveness between the two interventions. In separate sessions, we were alternating the treatments between these. The independent variables were the interventions themselves, and the dependent variable was the number of independent mending attempts that were made by the child. This study took place in the clinical setting and lasted 16 days. Counting the first 3 days which we needed for our baseline, where we didn't present any interventions, we didn't prompt the girl to request, and we saw, as you can see in our graph, that we had little success, but that's what we needed to know. Now let's talk about the results. During the baseline phase, the participant made, as I was saying, very few independent mending attempts. Once the intervention actually began, the results were striking. With PECS, the child made a significant increase in mending behavior, reaching up to 42 independent requests by the final session. And in contrast, we can see that sign language showed a slower increase in mending and required more prompts, with the participant occasionally engaging in more challenging behaviors. Here you can see the ABA style graph that visualizes the data, and we can see on the x-axis we have each session, and on the y-axis we have the number of independent mending attempts. You can see a clear upward trend in the PECS condition, whereas in language shows more variability and requires more prompts. This result suggests that PECS were more effective than sign language in this case in increasing independent mending behavior. This might be because PECS provides a visual aid that is more engaging for the children in autism, and specifically for this girl, and because it was paired with her reinforcement, and the visual helped her a lot to actually look at the pictures and scan them and exchange them in return. However, sign language still showed positive results, particularly in the early stages of the intervention. The girl was overgeneralizing one specific sign, and when we tried to introduce new signs for her to learn, it was very hard for her, and that led her to engage in challenging behaviors because she didn't want it to be prompted. We needed to prompt her physically in order for her to perform the new gestures that we were trying to teach her. And of course, we understand because sign language is a whole new language to learn. One important takeaway that I learned out of this study is that PECS might be a better intervention for children with limited verbal communication, specifically and especially when paired with motivating stimuli. However, sign language can still be a very valuable tool, and specifically for children who might benefit more from both visual and motor communication systems. Of course, there are some limitations for this study. For example, this study specifically was a single subject design with a very small sample size, so the results might not be very generalizable. Additionally, there was no follow-up phase to assess long-term retention of the skills learned, no maintenance, no generalization phase. And I will definitely suggest for future researchers that they need to involve larger samples and longer observations periods, and the exploration of maybe combining PEGs and sign language for enhanced communication outcomes. So in conclusion, both PEGs and sign language were very effective in increasing mending behavior, but PEGs in this case demonstrated a more consistent and faster improvement. This study definitely contributes to our understanding of how different interventions can be used to support communication development in children in the spectrum disorder. And that's it. Thank you so much for assisting this video. I am more than happy to answer maybe the questions that you might have. So thank you so much again for this opportunity.